Good morning, I'm Vic Senese with UroNurse News. Be sure to like and subscribe. Today we're looking at a comprehensive narrative review examining salvage radical prostatectomy or salvage prostatectomy for men whose prostate cancer has returned after radiation therapy. For years, salvage prostatectomy has been considered one of the most technically demanding operations in urology. Radiation changes normal tissue planes, increases scarring, and historically has been associated with higher complication rates and poor functional outcomes. But advances in imaging, robotic surgery, and patient selection are changing that picture. Today's review explores who benefits most from the salvage surgery, what outcome patients can expect, and how modern surgical techniques are improving both cancer control and safety. The message is clear. For carefully selected patients, salvage prostatectomy remains an important and potentially curative option. That's a real big change. In the old days, we always said the advantage of having surgery is you could always radiate later. Radiation, you couldn't do surgery later, but we're going to challenge that. One of the biggest advances isn't necessarily the surgery itself, it's selecting the right patient. Improved interpretation of multiparametric MRI and the widespread use of molecular imaging, particularly PSMA PET imaging, allows physicians to distinguish between cancer that remains confined to the prostate and disease that has already spread elsewhere. That distinction is critical. Patients with localized recurrence or limited oligometastatic disease may still benefit from aggressive local therapy. The review emphasizes combining advanced imaging with clinical factors including PSA levels, tumor-grade pathology, and overall health to identify those most likely to achieve long-term cancer control. This more personalized approach helps avoid unnecessary surgery while identifying patients who stand to benefit the most. So, how effective is salvage prostatectomy? According to the review, 10-year biochemical recurrence-free survival ranges from approximately 28 to 53%. Cancer-specific survival ranges from 65 to 83%, demonstrating that many patients can experience durable long-term cancer control. Historically, surgeons were concerned about complications after radiation therapy. The good news is that major complications, particularly devastating injuries such as a rectal injury, have become less common in experienced centers. The review also notes that robotic-assisted salvage prostatectomy continues to gain popularity. Although additional studies are needed, robotic techniques may improve visualization, reduce blood loss, and potentially improve urinary continence outcomes. Another important recommendation involves pelvic lymph node dissection. Because lymph node involvement is relatively common in recurrent disease, lymph node removal provides valuable staging information and may also have prognostic significance. Despite these advances, salvage prostatectomy remains a challenging operation. Erectile function following surgery is generally poor, although many patients already have significant erectile dysfunction before surgery because of prior radiation treatment. Urinary continence outcomes vary considerably across published studies, with reported continence rates ranging from approximately 20 to 80%. This wide range reflects differences in patient selection, surgical expertise, and how continence is measured. The authors conclude that salvage prostatectomy should continue to play an important role in treating localized prostate cancer recurrence after radiation. With better imaging, careful patient selection, experienced surgeons, and continued advances in robotic techniques, today's outcomes are significantly better than those reported historically. While this operation is not appropriate for every patient, it offers many men a realistic opportunity for long-term cancer control when cancer returns after radiation therapy. So, better imaging improves patient selection. Long-term cancer control is achievable. Complications continue to decline in experienced centers. Robotic surgery is advancing the field. Salvage prostatectomy remains an important curative option for selected patients. Hey, like, subscribe, and share this episode with your colleagues to stay current with the latest advances in urologic research and patient care. I'm Vic Senese with UroNurse News. Thanks for watching. See you next week for more. But first, tomorrow on UroNurse, Can AI help patients better understand their urologic condition? Can it make education more personalized, easier to understand, and more effective without replacing the human touch? Join me as I explore how artificial intelligence is transforming patient education in urology. If you care about the future of urologic nursing and empowering patients through better education, you don't want to miss tomorrow's discussion at 9 a.m. Central Time. So that's at UroNurse.com. Be sure to check us out. Don't miss it. It's over there. And hey, you know, AI can do a lot more than just make good education. Check out those guns on me. We'll see everybody tomorrow, 9 a.m.
Thanks for watching UroNurse News. The expert's opinion in this communication are personal and not representative of any organization. They are for informational purposes only, not official guidance. Viewers are advised to use their judgment, seek additional advice, and take responsibility for any actions based on these opinions.